you're going to find femoral. Okay, so we're going to work ourselves up. If we have someone who has a cardiac problem, we need to be able to palpate pulses in multiple places. For the upper extremity, it was the same way. We had the radial and ulnar pulses. Then you can go up and palpate brachial, and then work up to the common carotid. Then we also did some of the facial pulses. Again, we're trying to be able to assess the cardiovascular system, and so you need to be able to palpate in multiple places. For dorsalis pedis, you're going to go between the first and second ray, and then you're going to follow that up, and you're going to be over the tarsal bones. It needs a really light touch. If you push too hard, it's a very superficial pulse, and if you push too hard, you're going to blow past it. So if you can't find it, this is definitely one where you want to lighten your touch. And Afani has a great pulse right here. I can put an X on here for you.
Yeah, boy.
Okay. The extensor retinaculum is, again, just like we saw in the hand. It's simply going to be some fascial bands, one across the dorsum of the foot and then the other one over the proximal ankle, that keeps the tendons down. If that extensor retinaculum wasn't there, when he tried to dorsiflex his foot or extend his toes, those tendons would pop out of his ankle. Okay? So really, if everything is working well, we won't see that happen. So I'm going to have you bring your ankle up towards you, and then extend your big toes up. There you go. So what I'm looking for is there some reason that his tendons actually stick out further than they should? Go ahead and relax. Okay? Now the plantar fascia, I'm sure a lot of people have heard of plantar fasciitis, right? Take your so this is going to be something pretty common that you would treat in an outpatient orthopedic clinic. What you're going to want to do to find the plantar fascia is dorsiflex the foot passively. So go ahead and let me do it. There you go. And then I'm going to extend the toes. The plantar fascia is going to attach to the calcaneus and then come up over the foot. I forget sometimes, and I actually brush people's feet when I show it. That's ticklish. So then what you're going to do is you do need to use a rather deep pressure. I tend to use my thumb, but you can also use your fingers. Now again, it's coming up like a fan. So to go cross fiber, you're going to be pressing like this. But you want to have the toes extended and the ankle dorsiflexed, and you can start to see the tension of the tissues in the bottom of his foot. Okay? So that's going to be the plantar fascia. He's a little bit tight right there. Okay? So those three are fairly simple. We talked about the extensor retinaculum, we talked about the dorsalis pedis pulse, and we talked about the plantar fascia. Okay? Now we're going to palpate some structures on the lateral aspect of the ankle, which would require all of you to come over here. Okay, but you can't block.
Sorry, guys.
Okay, so now you're blocking my screen.
Good, everyone.
Okay, so first of all, so lateral ankle sprains are a lot more common than medial ankle sprains, and this happens, one, simply because the lateral malleolus is longer, so it's going to be easier for our ankle to invert, causing these ligaments to get sprained. Now, they get sprained in order with an inversion sprain. So there's the anterior talofibular, the calcaneofibular, and the posterior talofibular. Okay, so we have these three ligaments that just come off of the lateral malleolus like that. All right. So to palpate those, you're going to go cross fiber. It's not that you're going to feel specific ligaments there. There you really are looking for reproduction of symptoms. All right. So you're going to, anterior talofibular, calcaneofibular, and then posterior talofibular. So those are the ligaments you have to palpate. The peroneal tubercle is going to be inferior to the lateral malleolus, and there's going to be a bump there. And that bump helps separate the tendons of the peroneal group. Okay? So you're going to feel a little bump there. Now, there is a fascial sheath that can cross from the peroneal tubercle superiorly, and that sheath, if there's swelling underneath that sheath, you can actually have a nerve entrapment, and that can cause the tingling, the numbness. Okay, so that's another reason why you need to palpate the peroneal tubercle. Then for the head of the talus, we talked about the trochlea of the talus. We're going to palpate in the mortise, and we're going to have them plantar flex. If we go anterior to the lateral malleolus, do you see that little indentation there? That's called the sinus tarsi. Okay, and you're going to palpate the head of the talus in that sinus tarsi, or tarsi. Okay, so the bone in that gap is going to be the head of the talus. Right? So on the lateral structure, on the lateral structures, we're going to palpate, if we do it in the actual order of the slides, we're going to go to the sinus tarsi. You're going to find the head of the talus there. Your ligaments are going to be here, here, and here. And then you're going to palpate the peroneal tubercle. It's going to be a little bit inferior right there. Okay? So let's have you go palpate those lateral structures, and then we'll switch over to medial.